I'm Dr. Seth Greenky from Syracuse Orthopedic Specialists. My specialty is hip and knee reconstruction, which encompasses surgery related to the hip and knee replacements, arthroscopy of the knee, open reduction, internal fixation of fractures around the hip and the knee. I'm from Buffalo, New York originally, grew up in that city, and then went to Northwestern University, and then for medical school went to Upstate Medical Center, did my orthopedic surgery residency there, and then went to the Cleveland Clinic where I did a adult reconstruction fellowship. I think treatment philosophy is pretend the patient is your family member. I try to bring empathy and passion to the practice. Orthopedics is a specialty, and especially joint replacement, where immediate gratification is fulfilled. Because someone comes in and they're in terrible pain or discomfort, and most of the time you can, in relatively short order, get rid of that pain. Having been an athlete at Northwestern University in wrestling, really wasn't thinking of even medicine, and my brother Brett had a bad knee injury. And we were in Chicago by ourselves, and one of the orthopedic surgeons that took care of Brett just became our friend. And he was actually one of the pioneers of arthroscopy, which is an everyday procedure in orthopedics now. And he said to Brett and I, he said, "So what are your guys' plans?" And I was like, "Well, we might be gas station attendants, perhaps work in a supermarket or something like that." And he said, "Why don't you guys think about orthopedic surgery? I think your personalities are well suited to that." And that's how we decided. We want to be on the cusp of everything. We don't want to be the first ones to do things, but we're never the last either. We're involved in research, and we're involved in teaching residents for the last 30 years. We go to a lot of conferences, we've spoken at conferences, so we're up and participating in the latest things. And so anything to do with hip and knee reconstruction, we're pretty versed on. And things that perhaps we don't do because it's extremely rare or unusual, we know where to send the people. SOS formed as a union of 3 groups, each group being a major player at one of the 3 hospitals, Krause, St. Joe's, and Community. And it was bringing together 3 feuding families, like the Clampetts. And so the fact that we were able to somehow coalesce into a unit and grow into a group that I think is well respected, not only in the Syracuse area, but throughout the country. Operation Walk is something we've been involved in now for about 10 years, and it's one of 13 centers around the country that goes overseas. And I mean, we go to places that would never see a joint replacement. In a million years did we not land there in our rocket ship. Ghana and Nepal, places in Panama, Guatemala. So I'm super proud of that. Joint replacement has undergone an incredible evolution over the years. When we first went into practice, people would go in the hospital and they'd be in the hospital for a week. Then it went to 4 days, then it went to 3 days. And now there is a really concerted movement that has incredible benefits to do joint replacements in people who can as an outpatient. And in order to do that, you have to have a facility that is on the cutting edge, that is developed almost specifically for that. And although we have a surgery center now, we never felt like it was quite to the standards that we needed to do joint replacements. And therein is the reason for our new center. I think that, we talk about passion and we talk about the work-life balance, and I think that our goal is to have this be recognized as one of the best places in the country for quality. That's our goal, and I think we can honestly do it. I've always been a big fan of my children. They're all grown up and doing their own thing now, and that was always a huge thing when they were younger. I've always enjoyed, working out. That was part of my life for so long, in college and being on a scholarship and everything. That was a huge thing for me, and that sort of carried over into the rest of my life. I like traveling a little bit, like reading, stuff we all enjoy doing. There's certain things you can control in your life. You can't really control how athletically gifted you are, what your IQ is, how tall you are. But one of the things you have control over is how hard you work and your passion. Those things, doesn't matter what you're born with, you can bring that to the table and excel and beat everyone else if that's your goal. There's a self-gratification. You have to be very, very careful that you don't let your ego that is fed by people being appreciative get in the way of the reality of the situation. The reality is we just stumbled into this profession that just by luck. I mean, if Brett wouldn't have hurt his knee, who knows what we would have been doing. And we stumbled into a profession where just by the grace of God, we're allowed to do things that change people's life every single day.